You've been told a lie. For most of your life, people have said that masturbation was something to be ashamed of, that it was somehow dirty or only for younger men. By the time you hit 50, they said you should have outgrown it. But here's something no one ever mentioned. After 60, masturbation isn't just normal. It might actually be one of the most important things you can do to stay healthy and well. I've spent over 30 years helping men just like you. My name is Dr. Mohit Kara, and I'm a urologist and a professor of men's health at Baylor College of Medicine. Over the years, I've seen the quiet damage caused by shame, silence, and misinformation. Too many good men have suffered, not because of a serious illness, but because of something they were never taught. The truth is, most older men either stop masturbating completely or continue doing it in a way that doesn't serve them anymore. What they don't realize is that how you touch yourself, how often you do it, and the mindset you bring to it, all of that can affect your hormones, your heart, and even your brain. One simple act, when done the wrong way, can lead to problems like erectile dysfunction, low mood, and even prostate issues. But when done the right way, it can support your testosterone, help you sleep better, and keep your blood flowing. This isn't just about pleasure. It's about keeping your body functioning, keeping your connection to yourself alive, and pushing back against the effects of aging, right where it starts, in your nervous system. In just a moment, I'm going to walk you through 7 important truths about masturbation that every man over 60 should have been taught long ago. But before we dive in, I want you to ask yourself something. If just one part of your daily routine had the power to improve your health, your mood, and your energy, wouldn't you want to know what it was? I encourage you to stick with me here because what I'm about to share could change how you live the next decade of your life. Before we go on, if you haven't done so already, please take a moment to subscribe and turn on the notification bell. That way, you'll never miss another honest, science-based health tip made just for men your age. And if any part of this message feels like it speaks to you, I'd love to know. Just type the number 1 in the comments. If not, that's okay too. Type 0. Your feedback helps me create content that truly supports you. Alright, let's get started. We begin with something most men never hear until it's already caused them real problems. See, the way you've been masturbating over the years, maybe even for decades, might feel familiar, even harmless. But once you're past 60, that same old routine can quietly start working against you. That brings us to the first and maybe most overlooked mistake that older men often make when it comes to self-pleasure. It's subtle, it creeps in without warning, and over time, it can cost you far more than you think. Secret 1. Mindless masturbation can lead to numbness and erectile problems. This is something I wish more men had the courage to talk about. Over the years, I've had countless older patients come into my office clearly uncomfortable, their voices quiet, eyes cast down. And when we finally had an honest conversation, I'd ask, "Do you masturbate?" There would almost always be a pause. Then came the confession. "Yeah, but I don't really feel much anymore." Or, "I can't finish unless I do it just the right way." Or the one that really sticks with me. "It's like my body forgot how to feel." What they didn't know was this: the way they'd been masturbating, fast, mechanical, disconnected, had actually trained their body in the wrong direction. And that kind of routine, done over and over again, can lead to real problems. Mindless masturbation isn't just a bad habit. It actually conditions your nervous system in a way that can backfire. Every time you rush through it, tense in your shoulders, maybe scrolling through intense images, always using the same hand, the same motion, chasing the same outcome, you're teaching your brain to expect only that one specific pattern to feel aroused. And here's the thing. Your brain is a fast learner. Over time, your sensitivity drops. Erections get weaker. You might need more stimulation, more pressure, more tricks just to feel the way you used to. And when you're with a partner, it becomes harder to respond. It feels different, to slow, to real, and that disconnection starts to show. That's when the deeper damage starts, not just in your body, but in your spirit. I've seen men start to feel frustrated, ashamed, even depressed, thinking something is broken inside them. But in many cases, nothing's broken. Their body has just been trained into dysfunction. This pattern can lead to something called porn-induced erectile dysfunction. It can also cause delayed ejaculation or even make it impossible to climax at all. These aren't rare problems. They're affecting millions of men, quietly. And the most painful part, most of them never realize it's something they unintentionally did to themselves. Now here's what I want you to hear loud and clear. When you condition your body this way and you don't make a change, the loss isn't just sexual. You lose confidence. You lose connection, not just with others, but with yourself. Your relationship with your body grows cold. You start to avoid touch. You pull away from closeness. And that isolation, that's what opens the door to something even darker. It becomes emotional distance. It turns into depression. And yes, in some cases, it can even be tied to the early signs of mental decline. I've seen it again and again. The cost doesn't just show up in your sex life. It shows up in how you feel about yourself, how you walk into a room, how you look at your reflection in the mirror. Little by little, you begin to fade. But let me be clear. I'm not here to make you feel bad. I'm here to help you wake up, to see that there's a way forward. Because here's the good news, your body can relearn. Your nervous system can heal. But it takes some awareness. It takes patience. And it takes a new approach to touching yourself, one that's slower, more mindful, more connected. Not just connected to sensation, but to emotion. Masturbation isn't the enemy. But doing it without thinking, without feeling, is like getting in your car, putting it in gear, and flooring the gas without steering. Eventually, you crash. And by the time you notice the damage, the repair might take longer than you expect. Now here's something that might surprise you. While mindless masturbation can be harmful, there's something else, something even more common, that can quietly hurt you too. And strangely enough, this one is often seen as a good thing. In the next secret, I'll explain why not masturbating at all after 60 might actually be harming your health more than you think. If you're still with me and this message is striking a chord, just type the number 1 in the comments to let me know you're here. Now let's keep going. There's something important you need to hear next. Secret: masturbation helps reduce prostate congestion and inflammation. I remember a man I saw a few years ago, let's call him David. He was 68 years old. He was proud, kept to himself, and wasn't the kind of man who liked to talk about personal matters. But he came to see me because he was waking up 5, sometimes 6 times a night just to pee. He said he felt pressure, a sort of fullness, and even a dull ache deep in his pelvis. He figured it was just old age creeping in. What he didn't expect was the question I asked him. When was the last time you ejaculated? He looked at me like I'd asked something completely out of place. Years, he said. I haven't had sex since my wife passed. And to be honest, I thought men my age were supposed to stop doing that kind of thing. And right there, that's the myth that causes more trouble than people realize. Somewhere along the way, a lot of men start to believe that once they hit 60 or 70, they're supposed to shut everything down. But that's simply not true. And I told David exactly that. What he was feeling, the pressure, the nighttime trips to the bathroom, the aching, wasn't just age. It was a sign that his system was backed up and under pressure. His prostate wasn't being emptied. And over time, that can lead to inflammation. Now, let's be clear. I'm not saying that avoiding sex or masturbation causes cancer. But we do know that chronic inflammation in the prostate has been linked to a higher risk of prostate issues, including cancer. And we also know that regular ejaculation helps relieve that inflammation. It helps keep the environment inside your prostate healthier. So, what happened when David took this seriously? Within just a few weeks of getting back into a healthy solo routine, the pressure eased. He was sleeping better. But beyond the physical relief, something else happened, something I saw in his eyes. That little spark came back. He felt reconnected to a part of himself that he thought was long gone. And this isn't just about a few bad nights of sleep. If you neglect this part of your health, it can lead to chronic discomfort, medications you may not need, or even surgery down the line. Yes, it can even raise your risk of more serious issues. All because of a belief that once you hit a certain age, you're supposed to give this up, like it's no longer part of who you are. But that's just not how the body works. You wouldn't ignore your heart. You wouldn't ignore your mental health. And this is no different. The silence I see in older men around this topic is loud in its own way. I see it all the time in my office. It's not just in what they say, but in what they avoid saying. It's the way they glance away when I ask about their sexual habits. The way their shoulders slump when the word masturbation comes up. The way they make a joke to change the subject or quietly say, "Doc, that's just not something I do anymore. That was for when I was younger." But I can tell it's not that they stopped because they wanted to. They stopped because they thought they were supposed to. And that belief sits deep. It lives in the nervous system. It settles in the bones. And slowly, it starts to shape the relationship you have with your own body even now. What happens then? That disconnection becomes more than just emotional. It becomes biological. Because here's the truth, when you suppress desire, when you stop responding to touch, when you let shame and silence take over, your body doesn't just move on. It begins to shut things down. That kind of suppression, it's a form of stress. And long-term stress is linked to all kinds of issues: anxiety, depression, heart disease, immune problems, and even dementia. I remember one patient, 72 years old, recently divorced. He wasn't on any medication and he didn't have any major health issues. But he was tired all the time. He felt numb, isolated. He told me he hadn't been sexual in over a decade. Not with anyone else, and not even alone. "I just thought that chapter was closed," he said. And what I heard under those words was something sadder. Not grief over sex itself, but grief over losing that part of himself. Like he'd quietly said goodbye to something vital. But here's what I want every man to know: you're never too old to touch yourself with kindness. You're never too old to treat your body with dignity. And you're never too old to feel whole again. And if shame has caused this much damage over the years, just imagine how much worse it gets when hormone levels start to dip, too. Because the next truth is one most men never see coming. Your testosterone doesn't just drop because you're getting older. It drops even faster when you stop connecting with your sexual self. This is something every man over 60 should hear, and hear without embarrassment or doubt. Testosterone, that hormone that fuels your energy, your strength, your confidence, your sex drive, it doesn't just vanish because the calendar flipped another year. That's the story you've been told. But it's not the whole truth. What I've learned from decades of working with men like you is this: testosterone also drops when you stop living like a man who still wants to feel alive. When you ignore your sexual energy, when you suppress your desires, when you bury that part of you under years of guilt or routine, your body takes the message. It starts shutting systems down. I think of Frank, a retired firefighter, 73 years old. He used to be strong, steady, full of life. But when he first came to see me, he looked exhausted. His posture had slumped. He told me, "I just don't feel like myself anymore." I ran his labs. His testosterone levels were barely above clinical deficiency. And when I asked him about his sex life, he just shook his head and said, "I don't see the point anymore." That belief, right there, is the real danger, not the low hormone number on the test result. It's the mindset that tells your body to stop trying. But when you reawaken that energy, even through solo, intentional touch, your brain gets a new message. It hears, "I still need this. I still want to feel." And the brain listens. It starts switching systems back on, systems that may have been dimmed for years. And this isn't just wishful thinking. We've seen studies showing that sexual stimulation, even solo, can give a short-term boost to testosterone. Erotic imagination, physical engagement, even anticipation, all of it plays a role in hormone balance, mood, and energy. The hard truth is most men don't even realize how far they've drifted away from themselves until it feels almost impossible to find their way back. But there's a way back, and it doesn't begin with a pill or a surgery. It begins by reconnecting with your own body, on your terms, in your space, and without guilt. It's about reminding your biology that you're still in the game. And if that sounds surprising, just wait, because what I'm about to share next is even more important than testosterone. And most men don't know it. Now, here's something that's even more vital than testosterone, and hardly anyone talks about it. Erectile function. It's not just about sex. It's not just about intimacy. It's about your blood flow, your nerve health, your heart, and even your longevity. I once had a patient named Harold. He was 69, a smart man with a solid health history, but he hadn't had an erection in 5 or 6 years. Not because he physically couldn't, but because he thought there was no reason to. His wife had passed away. He wasn't dating. And in his mind, that part of life was over. What he didn't realize was this. His body wasn't just sitting idle, waiting for him to change his mind someday. It was already changing, and not for the better. The body is practical. If it thinks you're no longer using a system, it starts shutting it down. When regular erections stop, the smooth muscle inside the penis begins to weaken. The delicate network of blood vessels responsible for creating an erection becomes less efficient. Nitric oxide, a chemical your body needs to start and maintain an erection, begins to decrease. And this happens whether you're trying to be sexually active or not. It's biology. If there's no arousal, no engorgement, the body assumes it's not needed anymore. That's why even without a partner, it's important to remind your body that this system still matters, that it's still alive, still needed. And here's the encouraging part, you can do this on your own. You don't need a partner, you don't need pressure, and you certainly don't need shame. Just regular erections, even if they come from solo touch or non-sexual arousal, help keep the blood flowing, the tissues healthy, and the neural pathways alive. This isn't just about chasing pleasure. It's about preserving a fundamental part of your health. Your ability to get and maintain an erection is one of the clearest signs of your vascular health, which ties directly into your risk for things like heart disease and stroke. But there's something else. Something quieter and, in many cases, even more harmful than inactivity. It's a modern addiction that sneaks up on many older men. They don't always recognize it until it's already changed the way their brain and body respond to arousal. I'm talking about pornography. Now, I know just hearing that word can make people uncomfortable, especially older men. Some are widowed, some are alone, some aren't chasing excitement, they're chasing connection or maybe just a memory of it. But what many don't realize is that the kind of pornography available today is nothing like what they first saw decades ago. What used to be simple, static images or gentle cues has turned into fast-paced, high-intensity, instant gratification content. And our brains, especially aging brains, are not built to handle that kind of constant, high-level stimulation without consequences. The brain changes with repetition. Over time, it begins to expect exaggerated, artificial stimulation in order to feel aroused. And when that happens, the body follows. Erections become weaker. Orgasm becomes harder to reach. And in many cases, men find they can only perform with porn, not with a real partner or even alone without it. This condition is more common than you think. It's called porn-induced erectile dysfunction. And the emotional cost of it can be just as heavy as the physical one. I've seen men spiral into shame, guilt, and frustration. They start believing they're broken, that something is wrong with them. But what's really happening is that their brain has been rewired. And here's the good news, you can take back control. For some men, that means taking a break, 30 days without any visual stimulation, letting the brain reset. Others take it slower, easing off gradually. There's no single right way. What matters is the intention. You start to rebuild your brain's relationship to pleasure. You remind your body what it means to feel without the artificial intensity. And no, this isn't about giving up pleasure. It's about reclaiming it. Making it yours again? Letting it be real, honest, and grounded in actual feeling, not just stimulation. Because when porn dulls your senses, it doesn't just affect your physical responses. It can numb your emotions, too. And that kind of disconnection. That's where the most dangerous issue of all begins to grow. Isolation. And I don't just mean being physically alone. I'm talking about a deeper kind of isolation, the kind where you stop being touched, stop touching yourself, and slowly disconnect from your own body. Not because you've chosen to, but because somewhere along the way, you were told that this part of life no longer belongs to you. I remember a man named Peter. He was 76, a retired engineer. Polite, well put together, but there was something distant in his eyes. He said, "It's been years since I've had any kind of intimacy, even with myself. I figured I was just past that now. But here's what the body knows and shows us when we pay attention. When touch disappears, when intimacy fades, something happens in the nervous system. Oxytocin, the hormone of bonding, begins to drop. Stress hormones creep in. Blood pressure rises. Sleep suffers. The immune system weakens. And most importantly, the brain begins to shut down emotional and sensory circuits to protect itself. In other words, when we stop being touched by others or by ourselves, we begin to go numb. Not just physically, but emotionally. We stop feeling alive. We stop feeling the need to connect. And the worst part is, it happens so slowly, you don't even notice it. Until one day, you wake up and realize you're not sure how to feel anything at all. That is the real cost. Not just lost erections or faded desire, but the slow fading of your identity, your purpose, your spark. The quiet death of connection. And this kind of isolation has been linked directly to depression, heart disease, even early death. Not because of age, but because of abandonment. Not by others, but by yourself. Let me be clear. This isn't about blame. Life happens, loss happens, distance happens. But I've seen what's possible when a man decides to come back to himself. His shoulders lift. His posture changes. His voice gets stronger. That old spark starts to flicker again. And if you're still here with me now, if something deep inside you is nodding along, even quietly, then what comes next might be the most important part of all. Because now that you've heard the 7 truths no one ever told you, I'm going to show you exactly how to begin again. A simple, daily practice I give to my own patients. One that helps retrain your body, reignite sensitivity, and restore what silence and time tried to take from you. This next step, it's where real change begins. Your life, your emotional life, your physical life, isn't over just because someone, somewhere, said it should be. You've been carrying that lie for too long. We started this journey by uncovering the truth that mindless, disconnected masturbation can actually train your body into dysfunction. That rushing through it without thought or feeling can quietly rewire your brain and dull your sensitivity. We talked about what happens when you stop altogether, how avoiding ejaculation can lead to prostate congestion, inflammation, and in some cases, even increase the risk of more serious conditions. And that even something as simple as gentle, solo touch can help turn things around. We looked at how your erections aren't just about sex, they're a sign of your overall vascular health. It really is a use it or lose it system. And if you ignore it, the cost isn't just in the bedroom. It shows up in your confidence, your drive, even your memory. Then we open the door on porn, not to judge, but to understand. To explain how today's high-speed, high-stimulation content can quietly change the way your brain and body respond. That it's not about morality, it's about biology. And that what once brought you pleasure might now be numbing you instead. And finally, we touched on the hardest part, the silence. The way isolation can creep in. The way you begin to feel less alive in your own skin, less connected to yourself. And how that sense of emotional and physical disconnection can lead to real health consequences over time. But through all of this, there's one message I want you to hold on to. You still want to feel. Your heart still wants to open. Your skin still wants to remember what it means to be alive. And that journey back, it doesn't depend on anyone else. It doesn't require a partner. It doesn't require approval. It begins with a decision to stop shrinking, to stop apologizing for wanting to feel good in your own body, to stop believing that getting older means becoming invisible. Because you are not invisible. You're still here. And what you do with that, it matters. So here's what I tell my patients when they're ready to start again. Not with pills, not with pressure, but with a simple, daily practice that begins to gently retrain the nervous system, that helps your body remember how to feel, how to connect, how to come back to life. Start small. Create a quiet space for yourself. Somewhere you feel comfortable, where you won't be rushed or distracted. No phones, no screens, no expectations. This isn't about chasing orgasm. It's about rebuilding connection between your brain, your body, and your heart. Begin by touching yourself without a goal, not just in the usual way, but more like an exploration. Gentle, slow, pay attention to how things feel, not just physically, but emotionally. Breathe. Relax your shoulders. Notice where your thoughts go. Don't try to make anything happen. This isn't about performance. It's about presence. You may feel awkward at first. You may feel silly or even sad. That's okay. Those feelings are just signs that something old is being stirred awake. Stay with it. Don't judge it. Just notice. Let your body speak. Let your nervous system remember. Do this for 5 to 10 minutes a day. Not to finish, but to feel. With patience and repetition, the pathways that may have gone quiet over the years can begin to light up again. Your sensitivity can return. Your energy can lift. Your confidence can rebuild from the inside out. And over time, you might notice something else, too. You start walking a little taller. You start feeling a little more like yourself again. You catch your own reflection and think, there I am. Because this isn't just about reclaiming your sexuality. It's about reclaiming yourself. And it starts right here, right now, with you.